Hi, my name is Trevor Hopkins, and I'm a physical therapist at Pro Sports Club in Bellevue. Today I want to talk about getting the nerves in your arm to move a little bit better. The reason why we might need to do that is because you'll experience numbness or tingling in your hand that could be coming from something more central to your spinal cord. It could also be coming from something down in your hand. Oftentimes patients will experience numbness and tingling in their hands they'll mistake for maybe carpal tunnel syndrome that is really coming from something up higher, located more centrally from your spine. Things that can cause the nerves up higher to become problematic are things like your posture, tight muscles centrally, or also some spots distally or along the length of your arm here. Today I'm going to show you 3 common nerve mobilizations, median, ulnar, and radial, to help free up the nerve along this path and help to dissipate some of the numbness, tingling, and pain that can come from this. So let's bring Scott in to demonstrate. So first we're going to describe mobilization of the median nerve. All 3 of these nerves, as we discussed earlier, exit from the cervical spine. The median nerve travels along the path all the way down through the carpal tunnel and to these fingertips here of the index and middle predominantly. We discuss the median nerve often with carpal tunnel syndrome because as it passes underneath the carpal tunnel, this is a common area for it to get entrapped. As we do this glide, we're going to mobilize the nerve from its origin point in the neck all the way down to the fingertips. I'm going to ask Scott to hold his arm up this way. This is a move that we're going to do extending the elbow, extending the wrist, and side bending the head towards. Imagine that the nerve is like a piece of dental floss. We're taking tension off in the neck as we add it along the elbow and the wrist. Next, we're going to move that whole nerve the other way, bending at the elbow, bending at the wrist, and side bending the opposite direction. I'm going to ask Scott to repeat this in sequence 3 more times. Now, as Scott does this, he may feel some light tension in the index and middle finger as we described. That's perfectly normal. Any painful symptoms should be discussed right away and modified. Good. Next, we're going to talk about the ulnar nerve. The ulnar nerve also originating from the cervical spine, but lower, and also takes one of its nerve roots from the first thoracic vertebrae, so the T1 nerve root. It too extends along more the posterior part of the arm and behind the elbow. Symptoms of ulnar nerve entrapment would be numbness, tingling, or pain in the pinky finger and ring finger. In order to mobilize this nerve, we're also going to start with the arm up by the shoulder. But this time, instead of pointing the wrist toward the sky like the median, we'll point the hand down towards the ground. The rest of this will look very similar. As Scott bends the elbow, he's going to side bend his head away and extend the wrist. Next, he's going to take tension off at the neck, extend the elbow, and flex the wrist. And I'm going to ask Scott to do 3 more repetitions of this as well. Just like the median nerve, at the top of this mobilization, Scott may feel some of that tension in the pinky and ring finger, but pain should be avoided. Good. The final nerve we'll discuss is the radial nerve. Symptoms of the radial nerve will travel all the way down to the thumb and partially on the dorsum of the hand. In order to mobilize this nerve, I'm going to have Scott internally rotate his arm, keep his elbow extended, and put his thumb inside of his hands. As Scott takes tension off of the system by side bending his head towards the right, so go ahead and side bend that way, he's going to extend the wrist. As Scott adds tension by bending this way, he'll flex the wrist. And I'll have you repeat that 3 more times as well. You may notice some tension in the thumb, again, avoiding painful symptoms. Thanks, Scott. I hope these techniques have helped you to eliminate some of the symptoms of numbness, tingling, or pain that you might be experiencing along the path of these nerves as they exit from your neck all the way down to your fingers. It's important, however, to keep in mind that pain along these paths could be due to something more local, and it's important to have a physical therapist give you a proper diagnosis.